Statistically, the rate of abortions per pregnancy has lowered over recent years. Sarah Walker, writer of short article 77 Shocking Abortion Statistics in 2022, writes that in 2000, the abortion rate in the U.S. stood at about 21.3 abortions per 1,000 women between 15 and 44 years of age. By 2019, it almost halved to 11.4. With access to contraceptives, we, as consumers, meaning you and I, can prevent unwanted pregnancies. However, no birth control is 100% effective and can lead to a sticky situation. Without access to abortions, women will be denied the right to their own bodies. Unwanted pregnancies can be a result of health matters, rape, or inability to raise a child. Abortion is a right. Making choices for your own body is a right, and these rights should not be taken away. As stated prior, abortions can be a result of an unwanted pregnancy for a multitude of reasons. Health risks, sexual violence, and the inability or desirability to care for and raise a child all come into play. Pregnancies are known to bring health risks along with them. However, some are more severe than others. Whether a risk the pregnant person or a fetus comes of pregnancy that is carried full term that is not viable is inhumane. Sexual violence is a frequent take one would hear during any pro-life versus pro-choice argument. How is it that anyone can even look past this point? To force someone to carry a fetus that was a result from rape because it is God's will. Jose Miguel Vivanco, writer of article Why Lawmakers Should Legalize Abortion, wrote, "Forcing a woman or girl to continue pregnancy in cases such as rape is a form of inhuman and degrading treatment. Despite accessibility to contraceptives such as birth control and condoms, accidents still happen. No contraceptive is 100% effective, even if using two different forms at once. One could use condoms every sexual encounter that they have and have an IUD implanted, which is a small plastic T-shaped thing that is placed in your uterus to prevent pregnancy. However, we often hear groups of people say that if you are careless enough to get pregnant, then you should have to give birth to that child and raise it. That is simply not the case, as no matter what you do, apart from abstinences, will truly protect you. When these accidents do happen, some parents are unable to provide and care for them, and some just flat out do not want to. Any child that is born into a family that did not want them would likely live a horrible life. I mean, imagine being that child and knowing that you were not planned, and suddenly you feel like you're a burden to your parents. You ruined the best years of their life if they were 20 years old when they had you. That is no way for the child to live, and it is impossible to make the parents truly love and care for said child. Then there's another alternative. Give birth to the baby and then give it up for adoption. However, foster care is not a good alternative. As a matter of fact, it may be even worse on the child's mental health, as oftentimes children are bounced back and forth between foster home and foster home until they find one that sticks. And when there is no home, no family, no one to call for help, no one to rely on, no one that sticks by them, they're gonna grow up alone. No family to call. 1 in 5 foster children report being homeless from the ages 17 and 19. Foster care is not beneficial when it is as overcrowded as it is. Having a foster family take care of 6 different kids from all different backgrounds is unfair. This will lead to the foster parents not being able to give each child adequate attention and time to learn more about what they do and do not like. And by the time that does happen, it's too late and the child is most likely moving on to the next house if not adopted. Abortion is an intentional termination of a pregnancy. 72% of clinics would be willing to do the abortion process at 12 weeks, about 3 months gestation. At 20 weeks, about 4.5 months gestation, this number fell to 25%. Accessibility to healthcare options that could terminate an unwanted pregnancy can lead to safely performed procedures. Before abortion care was readily available to women who experienced unwanted pregnancies, at-home abortions and even suicide was a solution for them. Without the safety that comes from medically performed abortions, women will resort to other options that can result in terrible effects. Christina Sanfilippo, author of short article, Why Women Should Make the Abortion Decision, Damned If You Do, Damned If You Don't, wrote, drugs that women took to induce abortions often ended in the death of the women rather than just the termination of the fetus. 18% of non-hospital facilities stated that they treated a minimum of one attempted self-abortion compared to the previous year's 12%. Jeff Diamond states that abortions typically occur during the first trimester of pregnancy. Abortions are performed most often prior to fetal heartbeat, and because it is still so early in pregnancy, the fetus has no feeling and is unable to feel the procedure going on. At the end of the first trimester, the average baby is the size of a lime. Not really big, not much feeling, not any thoughts. Of course, there are still many oppositions to women receiving abortions. However, it is crucial that those who are opposed realize what they are risking by voting to ban abortions. Lives are being put at risk due to the lack of research that many of those who vote against abortions do. Sure, you can say that adoption is always an option, which it is. However, who will fund these children that are already overflowing with foster care? Will more funding be placed into housing for these children? Will they weed out the awful people that get involved in foster care for the wrong reasons? For 58% of the U.S. women who had induced abortions in 2019, it was their first time that they had ever had one, according to the CDC. 4 in 10 women who had abortions in 2019, 40%, had no previous live births at the time that they had an abortion, according to the CDC as well. If you would like to inform yourself more on the topic and what an abortion can do to improve someone's life, give yourself some time to investigate it. Read up on companies like Planned Parenthood and what their beliefs are and how they help the community. Talk to a kid that had been placed in foster care for the majority of their lives and consider whether they think that they were raised in a good environment. Think about if someone close to you was raped and then impregnated, what would you want them to do? The reasons that abortions happen are a never-ending list, and many of them, if not all, are not the woman's fault. Regardless of your stance on abortion, the procedure saves lives and improves the quality of many. Put yourself in a woman who is seeking an abortion's shoes. Take the time to understand why this may feel necessary for some people, and yet let your feelings related to it go. After all, it is not your body.